In this video, we will walk through how to respond to difficult questions. As a Cancer Clear and Simple facilitator, it is inevitable that you will be asked some hard questions. You may not know what the answer is, and that's okay. Additional information can be found in the facilitator guide.
If a participant asks you a difficult question, it's helpful to listen to the entire question first, and then repeat the question out loud. This makes sure that everyone understands the question, plus it buys you some time. Assess if the question is relevant to the current discussion or topic. The question may be coming up later in that session, or it may be something that you can answer at the next session. If it is relevant to the topic, go ahead and answer the question at that time. If not, add it to the parking lot. For example, one of the questions that I've gotten in the past is, does a wood-burning stove cause cancer? So it wasn't something that we were talking about at that time, and I actually didn't know the answer to the question, so we wrote it in the parking lot. That way, I'm going to remember to come back to that question. So it's important to remember that we don't have all the answers, and sometimes questions are going to be raised that we don't know how to answer. And that's okay. When a question arises that you don't know the answer to, there's several things that you can do.
First, let the group know that you are not a medical expert.
The other thing you can do is refer the participant to an appropriate resource. For example, in our sessions, we have where to find more information. That includes the National Cancer Institute and the American Cancer Society. There are additional resources and information at the end of each session in the handouts, where to find more information. If the participant is willing to research the question on their own, find that out, ask them that, and then they can bring that information back to the group at the next session. Also remember, local resources are really valuable. Some participants may not be aware of opportunities that are right in their backyard for screening or for prevention support. So remind them of those local opportunities.
Asking participants to look into their own question is a great way to increase knowledge and help inspire health promotion. That being said, there may be situations where you might want to look into the question yourself. Don't commit to answering that question unless you know you have the resources and the time and the capability to report back to the group. If you are comfortable and capable of bringing information back to the next session, let the participants know that you're going to do so.
Also, feel free to contact your local lead facilitator. That may be the extension educator or the public health educator, for example. If there's some difficult questions, they may be able to help you find the answer to those.
Some questions just don't have a clear, concise answer, especially when we're talking about cancer, with it consisting of so many different diseases or different types, and the continued individualization of treatment and diagnosis.
When it comes to medical questions, it really is important to emphasize to individuals that they should talk to his or her healthcare provider.
Just remember, it's always better to say, I don't know, and refer them to an appropriate resource than to make up an answer and be wrong. Don't be afraid to say that you don't know the answer to a particular question.
We've also run into some participants sharing personal stories or personal issues around cancer, and it's really important to recognize that. It's always nice to thank the individual for sharing their stories and raising questions.